If you or someone in your family has atherosclerosis, then you basically have a situation where the plumbing in your body is clogged. Doctors call these clogged pipes plaques in your blood vessels. If you're faced with a scenario of having plaques in the blood vessels that supply blood to your heart muscle, known as coronary arteries, then you're at high risk for a heart attack. You see, like other organs in the body, the heart is made up of muscle cells that require blood with nutrients and oxygen in order to function. These muscle cells are unique because they transmit electrical conduction that allows the heart to pump blood in a fixed, rhythmic, automated manner. Believe it or not, this is actually what doctors are tracing when they perform tests like ECG or electrocardiogram. When blood doesn't get to your heart muscle cells, they eventually die. But before they do so, they dramatize the whole thing. They cry up a storm of enzymes called CKMB and troponin to tell the world that they're being neglected. They mess up the electrical conduction of the heart, they stop doing their job to pump the heart properly, and pretty much create havoc just because they didn't get enough bloody attention. Now, if you manage to rectify the block in the pipe in enough time, the consequences of the muscle temper tantrum are likely to be minimal. If, however, you decide to give the heart some tough love and ignore the situation, you're probably going to have to deal with some permanent consequences that you just may not enjoy. If enough heart muscle dies, then it will mess up the electrical conduction of the heart, which will cause it to beat irregularly, and you'll end up with an arrhythmia like atrial flutter or ventricular fibrillation. If the heart can't pump out blood properly, then you end up with heart failure. You can even have a problem where blood pools up behind the block and you end up with an aneurysm which can burst and pretty much drown your heart. If you're not sure of the situation in your body, go visit your cardiologist and find out if any of your pipes are blocked. It's better to know than to ignore the situation.